Hello, and welcome to UCSD's training on aided communication and a refresher on hourly rounding. Aided is a communication tool designed to standardize how we communicate with patients so that they could receive the empathy, caring, and effort we pour into delivering patient and family-centered care every day. Hourly rounding is a frequency measure to make sure that we assess pain, position, potty, and proximity to things. So when the two are combined, standardized communication at a high frequency, this has been demonstrated to improve quality, safety, and patient satisfaction outcomes across the country at a number of high-performing organizations. AIDED is an acronym that stands for First, Acknowledge. This begins prior to entering the room. Knock on the patient's door and ask for permission to enter. Then come in, make eye contact. Smile. Be seated when that's a feasible option. Patients routinely overestimate the amount of time you spend with them, and they also perceive you as listening more carefully when you are seated. If we're bringing something into the room or using technology could either be a bridge or a barrier. When charting electronically, swivel the monitor around to show patients what you're doing and explain how it benefits their care directly. Patients notice when we come in and are very task-oriented versus patient-oriented and holistically oriented. Acknowledgement is the way to recognize that we care for them. So greet, smile, eye contact, eye level. That's acknowledge. The next prong is introduction. The basics of an introduction are your name, your role, your title. What AIDED brings to introduction is one or two more pieces of information designed to build credibility and to reduce patient anxiety, such as your education, your skill set, or your experience, or simply the fact that you enjoy working with this team. It's also crucial to manage up your coworkers, manage up other departments, so that when you build trust, you build rapport with your patient, the next provider that comes into the room is going to be a recipient of that trust. You're going to hand off that trust. So we've hit acknowledge, introduce. The next prong is D for duration. Patients want to know three components of duration. They want to know how long until blank, how long is blank going to take, and then how long until meaningful results or impact or next step from blank. When there's a delay, it's crucial to keep the patients and families informed about this delay and let them know what we're doing to try to facilitate this process. Don't be afraid to apologize, to acknowledge that there is a problem and we're doing these steps to make sure you get what's needed. E stands for explanation. It's vitally important we use active listening techniques such as I hear you saying, if I understand you correctly, or if they're in pain, to say, I'm sorry to hear you're in pain. This lets the patients know that we're listening to them and that we empathize with their concerns. Also vital to explanation is using teach back, a familiar concept from basic nursing. This assures that the patient understands all the information we're giving them. So a way to do this would be, I just gave you a lot of information and it could be confusing. I want to make sure that I communicated this clearly. Could you tell me what you heard me say? So that way, if the patient makes a mistake, they don't feel like they just failed a pop quiz. It's my fault if I communicated in a rushed manner or if I was unclear. So taking the time in this stage in explanation to solicit these questions is going to dramatically reduce the use of call lights and sending spouses or family members up to the nursing station. This is a mutually convenient time for you to proactively address the needs of the patient, and it's been demonstrated to be useful at this stage. That was explanation. The next prong is thanks. Patients want to be recognized that they trust us with their care. We shouldn't use a script for thanks. This should be thanking the patient or the family member for whatever it is we're sincerely appreciative of. Thanks for your smile, thanks for your patience, Thanks for trusting us with your mom's care. And this brings us to a conclusion. We're thanking the patient, then we're asking, is there anything else I could do for you? So combined, we have acknowledge, introduce, duration, explanation, thanks. And Aidet is not a script. It's something that has to be practiced and personalized for it to be impactful. And for patient satisfaction, we have to do this consistently. This has to be always, with every patient, every time. Coupled with hourly rounding, we will be guaranteed to see a meaningful impact.
May we come in? May we come in?
Sure, come on in.
Good morning, Miss Smith. It's Maria, your nurse. As we spoke about earlier, it's time for change of shift report. This is Geraldine, your nurse today.
Good morning, I'm Geraldine. I'll be the nurse taking care of you this morning.
Geraldine is one of our top nurses here, and she's usually charge nurse, so you're in really good hands today.
Oh, that's good to know.
So I'll be giving Geraldine bedside report right now, which should take about 5 minutes. Is that okay with you?
Yeah, that's fine.
So we will be reviewing your electronic medical record. Please feel free to add in information or correct anything that we get wrong.
Okay, I will.
So this is Miss Smith. As you can see from the handoff report, she's a full code with no known allergies. Here's a list of her past medical history. She is here because of an infected left foot of unknown cause. Her wound has been getting worse after she went to the clinic and started oral antibiotics. Here you can see in her labs, her white blood cell count is elevated and her blood cultures are still pending. Miss Smith, an elevated white blood cell count means that you have an infection which we are treating right now. As you can see, her vital signs have been stable. She's been afebrile overnight. We started her on IV antibiotics. Her pain has been managed well on oral pain medications. This is Miss Smith's pain card. Her stated pain goal is a 3. When last assessed, her pain was a 3 out of 10. Miss Smith, how's your pain right now?
It's still 3 out of 10. I'm okay still.
Okay, good. So Miss Smith is a moderate fall risk because of her pain medication and impaired mobility of her left foot. Miss Smith, just as a reminder, please call for help when you need to get out of bed or need any assistance, so someone is here to help you.
Sure. I have my call ball right here.
Okay, I'm just going to take a look at your ID band and your IV, okay? Thank you. Thank you.
And also your left foot.
All right, thank you.
So the plan for today is that you're going to receive an MRI of your left foot. This is to rule out an infection of the bones in your foot, and you should receive it around 8 o'clock after you eat breakfast. Your pain medication is available at any time right now when you need it, so please call when your pain level gets above a 3.
Okay, I will.
In addition to what we had discussed this morning, is there anything you'd like to accomplish?
I would love to wash my hair if possible. I haven't washed my hair for 2 days now.
Okay, we can get that done today. So I'm going to write on the board that you would like to wash your hair, and we're going to attentively say for 10 o'clock, okay?
I would really appreciate that. That sounds a good plan.
Is there anything else we can do for you this morning? I can make time for you.
I am kind of hungry.
We just started a hot new breakfast menu this morning. Nutritional Services just finished us a phone call, and that means they'll be up in a few minutes.
Thank you for your time, Miss Smith. It was a pleasure to take care of you last night, and I'll be back again tonight.
Please come in. Good morning. Good morning.
My name is Dallas from Nutritional Services. I have your breakfast tray.
Great.
Can you tell me your name and date of birth so I know I have the correct tray?
My name is Jane Smith, and my date of birth is August 23rd, 1982.
Great. Here's your tray. Looks like you're having French toast and eggs today. Is this what you ordered?
Yes, that looks delicious. I'm hungry.
Okay, good. I'll be back in about a half hour to pick up your tray. Here's the fresh hand wipe so you can clean your hands before eating. Can you reach everything okay, or can I open anything for you?
I think I've got it.
Okay, great. Thank you. Enjoy your breakfast, and please call if you need anything.
I will.
Good morning. This is the RN6Cs. How can I help you this morning?
Hi, this is Kyle, technician from MRI. I'm calling regarding Miss Smith in room 606. May I speak with the receiving nurse, please?
Oh, may I put you on a brief hold
Yes,
while
that's
I
fine.
contact the nurse? Oh, you are busy with a patient? Okay. The primary nurse is busy with a patient. May I take the message?
Sure. We have a trauma patient needed on MRI staff, so we have a delay in our schedule. We should be ready for Miss Smith in about an hour. We will call you when we're ready for you to send her down.
Okay, thank you for the information. I will shoot to relay
Right,
the message
thanks.
to the nurse.
Bye.